Yeah, we got Dr. MJ Collier on this morning. Dr. Collier, good morning.
Good morning, Rickey Smiley, and all the Rickey Smiley Morning Show listeners. We are here with your coronavirus COVID-19 update for today. Let's start off with our statistics once again. On Friday, we had 680,000 cases. Today, we're counting them at 750,977, basically 751,000. On Friday, we had 35,000 confirmed deaths. Today, as of 7 a.m. this morning, we have 40,292 confirmed deaths. So the numbers continue to march on. So, again, one of the issues is testing. Where can people get testing? Testing is so difficult to come by. And I spoke about that last week. But we have now creating a partnership here in Atlanta with the Atlanta Medical Association and the Atlanta Dental Association, the AMA, and the DNA. And this is being headed up by myself, Dr. Frank Jones of the Atlanta Medical Association, Melissa Jones from the North Georgia Dental Society, and Dr. Bernie Johnson, an orthodontist. And what we're trying to do is to spread testing into the offices of dentists so that patients will have easier access to clinicians who can perform dental testing or who can perform COVID-19 testing, rather. So now, where are we now, Ricky? We got many aspects of people have gotten the disease. They have survived the disease. So what do we do with those individuals? When is a person safe for others to be around after being diagnosed? What about a person that was discharged from the hospital? When can providers and caregivers stop using personal protective equipment? The two strategies are this. Number one, a test-based strategy and a clinical-based strategy. These are both from the CDC. The CDC guidelines suggest now if a person has no fever and there's been clinical improvement and they've had two tests for COVID-19 conducted greater than 24 hours apart that are both negative, then precautions can be stopped at that time. The problem is that people have been tested positive, gone through a 14-day quarantine period, and then they're having difficulty getting repeat testing because nobody wants to test them because the testing is limited. So you have those individuals who are in limbo. They're not quite sure where they should be. The clinical criteria, that's the other strategy, is defined as no fever and a general feeling of improvement for 3 days after recovery and at least 7 days since the symptoms first appeared. So essentially there's a 3 day after the last sign of illness, but at least 7 days since the illness began. If a person completes 14-day isolation period in the hospital or in home, then that person should not be infectious. If they did not complete 14 days in the hospital or have not completed 14 days, then they're potentially infectious and people should still monitor themselves. The patient should wear a mask and any caregiver should wear a mask as well. So if somebody's visiting that person, they should be informed of the person's positive status and be given appropriate personal protection equipment, which should include a hand sanitizer and the ability to wash hands as well. So if somebody's coming to your home to visit you, then you need to provide, soap to wash their hands and or a hand sanitizer and a mask as well if you have been tested positive. So there's a debate in the literature as to whether people can experience reactivation of the COVID-19. I don't think that's actually happening, but you do have a few people who have problems with their immune system, so they might not have protective immunity as well as most people. But the usual and customary for a person that has had a viral infection like this is for a recovered person to have immunity. So I don't think the science of immunology has changed substantively, so I think that's where we're going to be. I'm going to quote Dr. Carlos Del Rio from Emory University, who coined the phrase, if after you've gotten over this disease, you can wake up with no fever and you can smell the coffee. So wake up and smell the coffee, then you ought to be good to go. So that's where we are this morning, Ricky, and we are going to bring you more information about these relaxation of these restrictions during the next segment.
All right. Hey, y'all, Dr. MJ Collier. Dr. Collier, real quick. Let them know how you can be reached.
Okay, all social media, ask Dr. MJ. That's Ask Dr. MJ on all social media, and we'll respond to your questions. And we're going to do some live Facebook presentations this week, as well as a couple of Zoom conferences we're going to invite people to tune in on.
Guarantee is up next.
The Rickey Smiley Morning Show, baby.